Okie doke. So, it's Monday. Um, Still in the hospital. Still, my little single has started beeping blue. I expect them to come in here in a minute to make sure I'm not dying. I have been staying with the door closed when I can because the hospital environment is a bit traumatic for me. 95 plus percent of my interactions here have been good, even healing to me, as I have a intense distrust of the medical industrial complex, the system that bases its profit off of human illness. It is a fox guarding the henhouse type of situation. That said, there's still some things that a person deals with that they would be best to accept medical help. And that's what I'm learning to do. So, part of the problem is that America has become a society where whether or not someone can sue you tends to be the subconscious driving factor of most professionals and businesses' actions, right? It's probably not a good way to function or build a world, and it's an absolute perfect way to function. I can't really summarize it with words, but it is serving who it's serving. Let's just say that, right? Humans who live in fear of being sued when being sued can destroy your life. That benefits one small group of people at the to the detriment of everybody else. Let's just say that it's not really funny, but you have to laugh, otherwise you'd cry, that America created a nationally famous awarded program called Breaking Bad, where a respected college chemistry teacher was literally forced to cook and distribute methamphetamine just to pay for his cancer treatment. Go America, land of the free, home of the slave. Please don't be offended by that if you're just a human stuck here like the rest of us. But if you're on team rah 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 go America, well, that's what you're cheering for. So maybe we can not do that. I don't know if y'all heard that, but apparently God gave me a little like exclamation point to what I said. So, my brain is a little unbalanced. I've had a couple of traumatic experiences here in the last 24 hours. I'm still not cleared medically to leave. I'm not going to leave against medical advice. They are focusing intensely on the fact that I do have congestive heart failure, as was expected and is my experience with the American medical system. They are doing everything they can to diminish and ignore even the possibility that I have a parasite. I have tended to avoid medical care because I would rather just die than continue to be have my experience diminished and invalidated just because it's not understood in this country. Now, what I'm trying to explain for now, what they're not acknowledging and treating, and what is driving me batshit insane, the explanation that I've discovered, or at least temporarily settled on, my body is infested with something. I can touch it, I can feel it, it's magnetically guided and attracted to my fingers or repelled. I can feel it moving and squirming around my face, coming out of my ears. It has created this nest in my ears. I can move it around, so something then comes out of the nest and starts dripping down my side. When I work with the parasites under certain conditions, and I do this because, like I said, it's all in my eyes. It's at the corners of my eyes. It's affecting my vision. You can see it as created that bulge there. You can see it have its roots put up through my eyebrows. Now the swelling you see like that is intensely painful to me. I am literally pulling something. Just by doing this, I can feel it pulling something out of the corner of my eye socket. When I pull things, it always brings it to a center here, right in the middle of my third eye. At worst, or in its most severe cases, I develop, let me see that, these places on my skin that erupt in this bloody black pussy thing. I can't, let's see if I can do it with my eye. I can do this along its tracks and lines, and as I turn, it's pulling something, creating more and more pressure. And the times I have done this long enough under the right conditions and the right environment, I don't know what the variables are that has contributed to success in the past. Otherwise, I wouldn't still be dealing with this, but I can do this, herd it along, move it in such a direction that it seems to be pulling out damaged scar tissue, let's say, bring it to the surface and expelling it. The other thing is that it has also expelled both black dots and white, either egg sacs or larvae. Furthermore, these things are all in my sinus. If I could show you this, they create exit holes inside the corners of my nostrils, and then my whole nostril and sinus are just caked with this hard, it's like dried pus, but it's a scab, and every morning I pull them out, but then I still feel congested and painful all day. They definitely have points here, here, on the inside points of the nostrils, below, if you can see that. They have gone through my lips, so you can see there, and there. And I say, if you look again when I flex my muscles, there, all along that vein, they seem to travel through veins. They come out of hair follicles. I don't know what you can see on the back of my head. So there's clusters of them that they feel like they're deforming my skull. Some of the delusions that have come with them are that I was bred by Shriners and Freemasons to be a philosopher king, and I'm evolving into the Anunnaki version of myself. Prove that's not happening. I can show you things that indicate that it might be. I can definitely tell you things about my personal history that would lead even the most sane and skeptical of people to ask, what did you just say? So, I have had many stage names, known by many names, called many things. You can call me anything you want except late for dinner, because I'm hungry. But that is why I make this, whatever you call it, identity as Hiram Theodore Widowson. You just call me Hiram the Widowson for short. What do I think is happening? What have I pieced together from little things in a way that can be clearly defined as part of my schizoaffective post-traumatic delusions? I was bred to do something and be something. I was sent to Peru to train to do it. I have now been brought back here to do it. It is a very helpful thing to humanity. It is very sane and grounded and involves preparing for the transition of this from this world to the next. This is what your Bible calls the apocalypse, which means the revealing. And some of us are being what you would call resurrected. The step of that being these medically unidentifiable squirmy wormies going through the human body to remove all scar tissue damage and toxins before it evolves into what I've come to call Homo Illuminatus. As for me, I can already run around the forest without no flashlight and play games with gangsters that were maybe there to do something that I'm not even going to comment on, only to say that I ain't saying shit because I didn't see shit because I don't know shit. But I don't know. A couple months ago, I got to run around my little forest home in the middle of the night with no flashlight, trying to understand why there was a paramilitary group there and what they were doing. And as much as I understand what they're doing, I ain't got shit to say about it. Only to say that it's choice time for everybody. Do we feed the white wolf? Do we feed the black wolf? Do we accept that everyone with a belly button is our family and we should treat them with loving kindness and compassion accordingly? Or do we just want to satisfy our egos that make us debilitated with guilt until we just throw some money at some suffering people and say we did our part? That's only one example of what I'm talking about. But, and I am rambling, and I am stamped as having schizoaffective disorder and PTSD, because I communicate with angels, and I don't care what other people have to say about it. They have only ever inspired me to be a better version of myself. They have never done anything that fits classical schizoaffective diagnosis or warranted being chemically lobotomized. Oh, I mean taking medication for it, right? One of the ironies I'm learning to deal with is that I am called a delusional drug addict, or thought of as such by people who are too polite to say it to my face. But I appear to be that Not because I am that, but because I'm a mirror. I don't use drugs. I don't like drugs. I would say that I am not offended by certain plant-based sacraments when used respectfully. But that's it. And what I'm trying to talk about is that what started my PTSD breakdown here, and what prevents me from pursuing medical treatment on a regular basis. An example of that is when the first hospitalist assigned to me came in and said, "You have congestive heart failure, which is probably from meth use." Word for word quote. That's offensive to someone who doesn't use methamphetamine. So, when you label something, you put it in a box, you stop seeing it or hearing it for what it is, you stop interacting with it, and then you only interact with the label. I don't have any more time or patience to be treated like a label that does not even apply to me. My broken reactions to that, well, they colored pretty much my whole life since I was 12, and they're probably the root of almost every problem I've had in life. So I make these videos to communicate who I am, where I'm at, what I'm doing. I love my parents very much. Sometimes I find it difficult to interact with them. Sometimes I find it difficult to reconcile their points of views or opinions of me or all that sort of stuff. But I make this all public because every bit of suffering I have been through is useless unless I can communicate it in a way that helps others not have to suffer in the same way. So that's what I'm trying to do. There it is. There you go. There. I'm sorry that I do this when I talk. I literally have these like invisible or microscopic things squirming out of me so much that even when I talk, it's like all these swollen veins. That's them. That's not normal to me. And the places that they come to moles and like, where they terminate, I've been able to like push that and crush it until some sort of chemical comes out, and then they spread everywhere. All right, so that's enough for me now, and now I have a doctor to talk to. Yep, that's me.